I'm Richard Fitzgerald. This is Dubai Works, where we interview the business leaders making a difference in this great city.
That business with scalability was very interesting to me.
I like building something that has legacy.
I spent the first half of this week in Saudi Arabia and I watched some of the World Cup, and I watched some of the World Cup in Dubai yesterday, and of course we've got the final this week, and it's just inspiring to see Morocco and Saudi Arabia, and I just come to think of how many young people can get more active and more involved in sports. And also being at the STEP conference in Saudi this week, I've seen so many entrepreneurs offering tech solutions, and it's quite fitting that this interview is about solutions for health and diseases around obesity, but also technology and entrepreneurship as well. So enjoy the conversation. Welcome back to another episode of Dubai Works Business Podcast. With us today is Leyla Azizova. She is the co-founder of WEMA Health. They are a digital health startup aiming to tackle the rising obesity rates across the Middle East. So we're going to talk about how WEMA is set up, the ideas behind it and the background, the health and wellness industry in the region, and then a look to the future. So good morning, Leyla.
Hi, good morning, Richard. Thanks for having me.
So we have a confession to make, don't we, to the listeners, that we recorded this a few days ago and completely 100% our error. We corrupted the files, so that was a dry run and we have to talk it again. But it was such a good conversation, and I'm so keen to sort of chat through it again and hear all about what WEMA Health is. So can you start and just tell us a little bit about the company?
Sure. Happy to do that. So at the heart of WEMA Health is treating people that are obese and helping them in their weight loss journey, and doing that in a way that works and that is also sustainable, right? So that works not only for a short period of time, but that works ideally for the rest of our patients' lives. And when I say obesity, I am talking about those people that are overweight and are clinically defined as obese because they have a certain body mass index. We're looking at a body mass index of 27 and above. So this is not for, those of us that just want to lose a couple of pounds before an event or before the summer break, but it is for clinical obesity. And what we do in our program is to offer a weight loss journey that includes, on the one hand, anti-obesity medication, and that is the latest medication that is available and that's clinically proven to help with weight loss. It's called GLP-1 medicine. The second part is a very personalized health coaching with obviously a specialized endocrinologist, so a doctor who is specialized in the treatment of obesity, as well as with a nutritionist and health coach, so someone that is specialized in helping you develop healthier habits in all aspects of your life. And then the third thing is that we're using our technology platform to do this as data-driven and as efficient as possible for our patients.
Amazing. So it's in the health space. It's a clinic. At the moment, it's online only. And do you see this as a sort of a technology-enabled solution as well?
Yes, absolutely. It's a technology-enabled solution. At the same time, so we have launched in Denmark, and we are currently preparing our launch in the UAE. But something that we have also noticed is that a lot of patients, apart from having that virtual touch point and the virtual platform, that they also like to have a physical space that they can go to. So something that we're preparing for in the UAE for next year is to actually have a physical space, a physical clinic that people can go to have to access the care.
Okay, interesting. And how did you come up with well, first of all, what's the name WEMA? Where did it come from, and how did you come up with the idea?
Yes, so WEMA stands for weight management. And when it comes to how did we come up with the idea, it's very clear that obesity is a big problem in the world, not only in the Middle East, but in many, many different parts of the world. And it's a disease, and that's what we have to also acknowledge and say, right? That it's a disease. It's not only a symptom of other diseases like diabetes or cardiovascular diseases, but it's a disease on its own. And it can severely impact people's lives, people's longevity, how long people live, and it can also impact their quality of life. And in fact, when you look at reports such as from the World Health Organization, obesity is defined as one of the biggest risks actually to the humankind, because it's something that is kind of creeping up on us, right? We talk about many other illnesses that are clearly and very tangibly dangerous for us. But when it comes to obesity, it's often a little bit neglected, I think, but it is very clear that it's actually a silent killer. It is a pandemic because it's all over the world, and it's affecting also younger generations more and more. So it's a huge problem, and once I think this problem is tackled well, it can actually help in many other aspects of healthcare. Many other areas of healthcare will actually not be needed even, right? If people are not obese, if people are at a healthy weight. So we saw that there is a big problem, and if we look at what are the current solution spaces, the solutions are not great because there's a lot of diets out there. I'm sure all of the
Trendy things.
Yeah, very trendy diets, the ketos, the fastings, and plant-based, and everything is sort of a diet program, right? And people swear by it. And then there's a lot of shakes and pills that people can consume. There's a lot of workout programs. And then there is also, which has become more and more popular in recent years, the surgical side of things. So the bariatric surgeries, where parts of the stomach are surgically adjusted and so on. So, but all of this somehow does not seem to tackle the problem, because the problem is still there. And in fact, a lot of people with these methods, a lot of these methods are not very safe. They're not validated by doctors and are not scientifically driven. B, they're not very holistic, so they don't really take into account the patient's overall health and also other aspects of their life and their lifestyle. And C, they're not sustainable, and that's actually the biggest problem. So what we see a lot is that people that are overweight, they use one or multiple of these methods that I just mentioned. They lose weight, and then they gain the weight back. Which is obviously very frustrating. So we saw that something is not working, and we actually need a very holistic program that includes the latest evidence in research, which is the GLP-1 anti-obesity medication that I talked about, as well as technology to make all of this very data-driven, very evidence-driven, and also easy for patients, as well as this health coaching. So that's why we bundled all of this into a program that works. I mean, it simply works, and it is sustainable. And I think ultimately that is what is most important, right? That it's sustainable. It's not just a short-term solution, but it is for life.
Interesting, amazing. So before we go into a lot of the terminology and the industry issues at large, to understand so I understand the concept now of WEMA Health, which is the solution to the problem is a combination of scientific test. Well, first a strategy and approach to tackling this big problem, and then a combination of medicine and coaching. So more assisted sort of long term, not just to understand the cause as well of what might be driving increased consumption of food, etc. But so how did you come up with this solution? Are you from the medical field, or what? How have you had some knowledge of this industry?
Yes. So I'm from the I'm not a doctor myself, but I've been working in healthcare for over 8 years now. So my personal background is in strategy consulting within the healthcare space. As a strategy consultant, I worked across Europe and the Middle East with clients in healthcare. So these clients were ministries of health, public health authorities, clinics or large clinic groups or hospital groups, as well as even health insurances. So really all different sides and angles of healthcare, which is why I'm very familiar with sort of the biggest problems and issues that we face in healthcare, as well as also sort of the trends sort of in healthcare, right? And what we can use to make healthcare be a better experience for patients. And I think that's how I got into this space. I've always been very passionate about startups, especially healthcare startups, because I like to believe that healthcare startups are, they have a clear purpose, right? I mean, at the end of the day, it is about helping people with their health in one way or another. And I was always very passionate about that. So about a year ago, I actually left my consulting job and I decided to become an entrepreneur and build a healthcare company myself as well.
Amazing. So what's the link with Denmark? And you have a clinic there. Was that a co-founder that's there that already had investment to create a clinic, or how does that work as well?
Yes. So the investment we had at WEMA Health is from Dawn Health, which is a digital health company in Denmark that we're also being incubated under as WEMA Health. And Dawn Health is obviously situated in Copenhagen, in Denmark, and that's where the link to Denmark comes from. And it is also a market where there is world-leading researchers and medical specialists in endocrinology that we've also been working with to set up the clinical model of WEMA Health.
Okay, amazing. So at the moment in the UAE, you are operational, you have clients, it is virtual. So just walk me through the process in terms of the customer or the clients, how they approach WEMA Health and what services are available.
Yeah, so in the UAE, we're not yet live. We are not treating patients in the UAE yet. We have a list of patients that have contacted us and they're on our waiting list, and we are also in contact with them, but we have not kicked off the program yet. So the patients that WEMA Health has are currently all in Denmark, in Copenhagen. We will be starting off to actually treat patients in the UAE, starting with the many patients that we have on our waiting list in 2023, beginning of the year.
Okay, and then from a commercial standpoint, what's your business model?
Yeah, the business model is obviously that there's a program fee that our patients, or I should say our members, because they become members of the WEMA Health program, that they pay for to be part of this weight loss journey, and that's a monthly fee that includes all of the doctor consultations, the health coachings, the technology platform, all tests and assessments that are being made, and that's the main commercial model. That it's members-driven subscription.
It includes the medicine?
It does not include the medicine. No, the medicine, it very much depends. For some patients it is covered by their insurance. For some patients it's not covered. Okay. So that's at the, that is sort of handled separately on an individual basis for each patient.
And the medicine would obviously be different as well. This one medicine, but the treatment and the dosage could be different as well. Yeah, the treatment and the dosage is different, and that's obviously also advised by our doctors. Which exact medicine is being used and how much of that, and there is sort of, you start off at a lower dose and then you titrate upwards. That is all being advised by our doctors.
But it's I mean, we're not the ones obviously selling the medicine, right? So we're not affiliated in any way with that. So that is sort of a separate category, but we help the patient obviously in the administration, and then in adjusting the dosage according to their individual needs and so on.
So you're not selling the medicine, but in terms of business license and activity, how are you regulated, and what sort of license do you need in the UAE for WEMA Health?
So because we are a clinic, we have obviously to operate in the UAE as a business, you always need to have a trade license. That's a given, be that in the free zone or in mainland, which we both have. And then it's the healthcare regulator that also has to issue a license in order for you to see patients and treat patients. And that's a provider license, so a healthcare provider license. And then the individual health professionals that you have as a clinic, they all need to be individually licensed for their respective specialty. So for endocrinology, for the dietitians are licensed as dietitians, nutritionists are licensed as nutritionists, so they all have their separate licenses as well.
Amazing. So that is kind of a lot of licenses. You've got in that situation 2 business licenses, a DOH license, and then individual licensing as well for the practitioners.
Yes. Healthcare is a very regulated business in that sense, Richard. It's a lot of licensing and regulatory work actually that goes into establishing a healthcare company here.
Okay, amazing. So let's talk a little bit about the industry. So particularly in the UAE, what it sounds like is that you're part of the health ecosystem, and although there mightn't be one obvious solution to a disease, I think that's common, right? If there's a disease that's problematic globally, there's many solutions, but there's not one single one. But do you think that there's a lack of overall providers in the obesity section, and is that what you're contributing to, or do you think it's quite if I've got obesity in the UAE, then I do have a number of options available to me?
Yeah, I definitely think there is a gap in the market. Absolutely. I don't think there is a lot of options for you when you're obese, and when you want to have treatment that works, right, and safe treatment and effective treatment, you actually don't have that many options, because I think there are some singular weight loss clinics here and there that all have their own approaches, and some of them it's more nutrition, nutritionist offices or nutrition-based programs. You have obviously exercise programs, those gyms that have weight loss programs, and then of course you can always see a general endocrinologist. But it's in my opinion, it's very important to treat obesity as a very distinct specialty. And in terms of endocrinologists that are specialized in obesity, and that apart from their medical expertise can then also offer the health coaching, that's not actually very much available in the UAE, unfortunately, and hence why we want to close this gap.
Okay.
Let me maybe explain in this way. If you see a doctor, obviously the doctor can, an endocrinologist can look at can do the relevant assessments, can look at your blood panel, can test, how resistant you are to glucose and all of these things, can check your hormones, and they will have a very clear opinion on what is needed for you from a medical perspective. But what you actually need is to have that sort of companion, right, in the weight loss journey. And that for us is the health coach, because weight loss, or weight, I should say, it's not just the hormones in your body. It's also not just the food you eat. It's not just it's so much more than that. The story behind obesity is actually so much more complex, right? Because everything from the way you sleep and how much you sleep, from your emotional health, from the health of your relationships with your family or your loved ones, to stress levels at work, to how much you actually move, all of this can affect actually your weight. So, and all of this has to be considered in one way or another. If you only look at the medical side of things, that doesn't give you the full picture, right? At the same time, if you only do a diet, that doesn't give you the full picture either. So that's why I think when it comes to healthcare professionals in this field, it's very important to combine a endocrinologist that has a specialized experience in obesity with a health coach that speaks with an obese person and speaks about their lifestyle and understands what their life is like, what they're going through, what their stress levels is like, and their relationships and everything, and then combining that into one solution. I think that is what is actually key.
Okay, interesting. And the medicine that you particularly selected, the GLP-1, describe to me, so how does that work? And when we last spoke, you mentioned that, if someone uses it, it kind of makes them less hungry, but then after a while, if they stop using it, they can put on weight again. Why is that? And does that mean that, that even with the sort of therapy and the coaching, that they might need to be dependent on this medicine permanently?
Yeah, that's a great question. So the way GLP-1 medicines work, GLP-1 is a naturally occurring hormone in your intestine. We all have it. And the medicine, the GLP-1 injection, actually helps to regulate that hormone. So you feel actually more satisfied, and you naturally feel more inclined to eat less. So you can control your hunger very well, your hunger signals with this medicine. Now, there is definitely a weight loss when taking this medicine. That's definite, right? I mean, that's proven with a lot of clinical evidence. So anyone taking this will lose weight. If, however, the rest of your life, your routines, your behavior in life has not been adapted in any way, and you still have, the same lifestyle, then of course the chance is, once you've lost weight, you stop the medicine, your lifestyle is the same as it was before, that over time, probably not immediately, but over time, that you can gain the weight back. And it doesn't mean that you're dependent on the medicine for the rest of your life. It's just the medicine needs to be combined with a lifestyle change. And the lifestyle change is what comes with the health coaching, right? With the health coaching that we offer. And the lifestyle change is actually very, very important. It's also not easy because as adults, we are obviously very oftentimes stuck in our ways and stuck in our routines, but it is important to have healthier routines when it comes to what we actually enjoy eating. Doesn't mean we have to eat steamed broccoli all day, but the choices that we make on a daily basis with nutrition, our movement, and again, I always mention it, but also our emotional health. Our weight, our health is so much connected to our mental and emotional health. So addressing any issues that there may be, and also addressing our sleep, that has to be addressed, right? That has to be kind of taken care of before getting off the medicine. Because if it's not, then it's just very easy to fall back into it means that you're still in your old habits, and then the medicine at some point stops working, and then you just gain the weight back, which is unfortunate, and that's not the right way of doing it.
So, but at the moment in the industry in the UAE, you have clinics who have endocrinologists, specialists there as well, and you also have quite an active fitness industry as well. And then this is a kind of a hybrid and additional solution. And then you obviously have, lots of specialists in therapy and different types of coaching and treatment, that side of things as well. We discussed the gap in the market, but I guess a question really around genetics versus disease. And I'm not an expert, but in the case of the hormones, a lot of that is related to genetics as well, right? So how can you change it, in this way? Like, is it not something that's hereditary in some level?
There is some level that may be hereditary, but it's not determining. So it's not. It doesn't mean that once you are obese, and maybe your parents are obese and your grandparents are obese, that you can actually never be a normal weight. Definitely not. It is not like other properly genetic conditions where there is a determinant, right, in your genes, and that's it. It's not like that. It's very much also behavior driven and lifestyle driven. Obesity, yes, it's a medical condition, but it is also very, very much lifestyle driven. And that's why, the medicine helps to really bring on a metabolic reset, you could say, because it regulates those hormones. And on top of that, the lifestyle change then does the rest, right? And so it's not, I think it can be very frustrating to think of your genetics as something that you're just stuck with. And in the case of obesity, it's not. You can definitely think about it.
You might know something that I was curious around recently. How come some people, when their lifestyle is, say, poor, or they're under a lot of stress, that some people put on weight, but with other people it has the reverse, where people lose weight if they're really, really stressed? How is that?
It's not really, you can't really explain it, to be honest, because everyone's metabolism is just different. Like every single person is different, right?
Yeah.
And everyone's metabolism, everyone's endocrinology essentially is different. Everyone's hormones works differently. So it's very frustrating. You see sometimes these people that also don't really take care of their health and just eat whatever they want and eat a lot of junk, and they appear to be healthy. And then there's the rest that, has to, count the calories and just be very careful. And they have a harder time. It can't be explained that easily, to be honest, because everyone's body is just differently. What can be done? Well, firstly, let me tell you this. Just because someone is not overweight and looks sort of slim or skinny, you could say, it doesn't mean that they're healthy, first of all, right? And vice versa. And also, it's, again, I come back to the lifestyle change, but the lifestyle can actually help. Adjusting your lifestyle can help with many, many, many things. Also in the way that you manage stress in the future. If you are someone that responds to stress with either not eating or with overeating, both of these are a problem, then you can manage that actually very well once you address that, once you speak to someone, you get help on how do I manage stress, and you see those triggers that actually lead to certain reactions, right? You identify those stress triggers and you learn how to manage that over time.
How big a problem, Leyla, do you think obesity is in the Gulf versus Europe, which you're familiar with? Is it statistically, and and where do you think some of these problems come from?
Yeah, unfortunately, statistically, it is a bigger problem here. If we just look at the obesity rates in the GCC, they're between 35 and 40% of the population, which is very, very high. And in Europe, it obviously depends on the country. In UK, it's a huge problem. In some other parts of Europe, it's not such a big problem, but the obesity rates are lower. In Denmark, where we obviously, where we launched WEMA, the obesity rates are around 20, right? So significantly less than in the GCC. Why are the obesity rates higher here? We definitely have a more sedentary lifestyle here in the UAE. I think we can all acknowledge that. And it's the same, I think, across many GCC countries. There is a lot of comfort, I think, in the lifestyle that we have, right? Where we're driving to places or being driven to places. There's a lot of, and I don't want to generalize, but we do see a pattern where life happens inside a lot, and not so much, the walking and biking outside, and actually making an effort, for instance, to get to work and already burning calories to get to work. We don't have that very much here. And then it's also, of course, the sort of the eating habits that we have here, right? In the GCC, there's a lot of eating out. There's a lot of fast food, and then I mean, food is obviously a very important part in life in GCC, but there is also a lot of consumption of, unfortunately, bad foods and unhealthy foods.
Yeah. Okay.
And all of this together just and then you could also say, the heat in the summers just makes it so difficult for you to even go outside, for a run or things like that. All of that, I think, just leads to overall higher obesity rates.
Some of the things, especially in Saudi Arabia, and there's a lot in the UAE as well, like there's initiatives for more active lifestyles. We've just had the Dubai Fitness Challenge.
Yeah.
There's a lot of things like that, and there's an emphasis on sports. There's the Vision 2030 in Saudi has specific KPIs. I think it's percentage of population that need to do 2 activities
Yeah.
of 40 minutes a week. So there's a, that's their way of tackling or contributing to, the other benefits, but contributing to as well. And of course it has economic benefit because there's more of an ecosystem around commercial activity around sports and the wellness industry and things like that as well. So do you think that, looking to the future, that you're sort of launching WEMA Health at an opportune time, that there are sort of tailwinds that can kind of help with tackle this problem, and that you can be part of that?
Definitely. I mean, I think I definitely see that in the government's agenda. There is an agenda to reach a happier and healthier life, right, for the population in the UAE, and the same also goes for Saudi Arabia and many other GCC countries. That agenda is clearly there. It is about, making people healthier. And as part of that, I think there's also a lot of awareness about things that I think there was not a lot of awareness about 10 years ago, right? Such as nutrition, such as movement, such as also mental health. We see a lot of open conversations about mental health now, which is also in a way new. So all of this, I think, is going in the right direction, absolutely. And I am very much encouraged by this to sort of set up WEMA in a place where there is such a strong now focus and emphasis on that is very encouraging.
Yeah, brilliant. And as well, something that we spoke about last time that struck me as part of your solution is that there are many diseases in the world that we have, and these things are big things that many people are tackling, but a lot of them you don't see visibly, and obesity is one that you see visibly. So, that was one of the things that when I asked why pick one disease, why not sort of now or in the future look at many diseases, that you said that obesity was such a big one that you wanted to focus on that.
Yes, absolutely. It's a big one, and in many ways it's the foundation of other diseases as well, right? It drives other diseases. It is a fact that people that have obesity, unfortunately, are more likely to have other metabolic conditions, are more likely to have cardiovascular diseases, are also more likely to have mental health problems. I mean, it is a huge problem. So that's why we are single-handedly, focusing on obesity at the moment. Of course, there are, many other areas in healthcare that needed attention. We are quite close to mental health as well, again, because there is this link between obesity and mental health. So in the future, I could imagine that we expand more into mental health services, but at the moment, we have that very laser sharp focus, and also our hands are full at the moment with
absolutely, and it kind of needs that focus at the start as well. But yeah, that is interesting, to understand where you're going to take this in the future. That we're not going to see WEMA Health as fill all what's the right words, clinics that offers every type of treatment to everyone. That it's more focused on obesity and something linked to that. But also, you're not going to go on the complete other side and open a gym and focus on PT training and things like that either.
Absolutely, yeah. Mm-hmm.
Interesting. So just talk a little bit about a lot of people who come from the consultancy background have an analytical approach and have exposure to big industry companies, and they would have worked with companies who are well funded and sort of incumbents and things like that. So they have a unique perspective, and they kind of strategically solve problems, especially on the, and then other people do the implementation of it. So, what's it like being now a year into this or so on the other side of the fence, and, being more sort of implementational as well? How have you found the transition?
It's been amazing, honestly. It's been the best choice for me to actually make that transition. And actually, I find that I can use my experience from strategy consulting very much as an entrepreneur, because as an entrepreneur, you constantly have to make strategic decisions, right? And be it what is your commercial model, who do you want to partner with, which markets do you want to be active in, how do you want to manage your finances, and so on. These are all strategic decisions. So I think my toolkit as a strategy consultant comes in very, very handy. At the same time, I'm very excited, actually. I was very excited to also work more hands-on and have sort of obviously more operational responsibility, right? From setting up teams from scratch, getting those licenses in place, and also learning new areas that I had not been exposed to as much before, such as growth marketing, or areas of technology that we're using. So it's been personally, it's been very exciting for me. I was never afraid to have a very sleeves rolled up attitude anyways. So using, I think, my experience in that toolkit that I learned as a strategy consultant, and then combining that with a very, proactive, sleeves rolled up attitude has been very, very good so far for me.
And just a question, running out of time, but just a question on, working with people with WEMA Health and people approaching you. In your experience, are people with chronic obesity, are they proactive about looking for solutions? Do they try lots of different things? Or is there a case where, they're a bit reluctant to try new things, or they're a bit, what's the word, sort of demotivated, and they're not out there looking for solutions?
You have both, but what I see certainly more, is those that are looking for solutions, because things they've tried in the past have just not worked. And I think I told you the story before, but I spoke with one patient who weighs 180 kilos, which is obviously severely obese. And he had lost before 70 kilos, right? Which is huge. 70 kilos is a lot of weight. It's even the weight of an entire person. And then he gained 80 kilos back. Very, very frustrating. And he had I mean, the 70 kilos he had only done once, and there had always been times in his life, oh, I lost 20 kilos, I lost 30 kilos, and then I gained it back. So a lot of people that come to us have actually gone through many different options for weight loss, and they haven't worked. And now it's kind of, they're coming with hope, right? For will this work? And also I see that a lot of people who are overweight are constantly looking for new ways of losing weight. So that's why they're more proactive. But that being said, there is also a proportion of those that are kind of, because they were so frustrated with other weight loss methods from before, that they're almost there is a level of demotivation. So what you mentioned is true, right? That they're kind of like, well, maybe it's just not going to work. Maybe that's just who I am, and I just clearly weight loss is not for me. But ultimately, I think everyone has hope, right? I mean, that's ultimately why they come to us. Otherwise, they would never even come to us. Even those few that are more, it's harder to motivate them. I think at the core, they must have some hope that this is working. Otherwise, they would not even bother with it. So, it's interesting to see sort of these people and what their individual histories are.
Interesting. Okay, so finally, we're at the end of the year. You're still a startup, but what's your wishes, Leyla, for 2023, and what should we expect from WEMA Health?
Well, I wish that we are live in the UAE, obviously, and that we provide excellent care to our patients, that our patients are happy and healthy and satisfied, and that we can just provide the best possible care to them. That's my main wish for 2023.
Brilliant. Well, thanks a lot for sharing the story again, but also it's great to see innovative solutions. It's great to see female entrepreneurs tackling actual important issues, especially in this region. So we'll be cheering from here, and thanks very much for telling your story and about WEMA Health.
Thanks a lot, Richard. Thank you for having me.
Thank you. Speak soon. Thank you to Leyla again for interviewing with us on Dubai Works on Smashy for the second time. I hope you enjoyed the conversation. Thank you to Shahir and Ali for producing and editing the show. It goes out on all audio platforms, mainly Angami, Spotify and Apple. You can get it on smashy.tv, iOS, Android, our most smart TV devices as well. Do check out and download our smart TV apps. You can watch the videos in full there. It's coming to the end of the year. We will continue the show. We will have an episode next week leading up to Christmas, and then an episode before the New Year as well. So we'll have 2 more episodes this year before we ring in a new year. As usual, do like, comment, subscribe, leave any feedback, and let us know if you know any startup or founder. If you yourself would like to be on the show, please do get in touch. Thank you, and speak next week.